So thanks for joining us today for this conversation on prioritizing mental, emotional, and physical health as we face election results, co-pandemics, and seasonal changes that are impacting our identities, our relationships, and our well-being. The workshop is sponsored by the University of Maryland School of Public Health in coordination with the UMD Counseling Center and the Office of Diversity and Inclusion, BISS Incident Support Services. It is part of the Happiness and Wellness Initiative and our vision to promote happiness and well-being for all, aligning with the University of Maryland School of Public Health's vision of physical, mental, and social health and well-being for all people throughout our local and global communities. Before we get started, I want to take a moment to center ourselves in this virtual space and our own physical spaces. I will first model for you and then ask you to join me in breathing. So we start by breathing in 4, holding for a count of 7, and out for a count of 8. Okay, let's do this together. Breathe in. Hold for 7. And out for 8. Great, thank you so much for doing that. It helps us get connected with our bodies, connected to the space, and it's a good technique for de-stressing. I'm going to go ahead and share a video that we created about the 4-7-8 breathing technique. One of our undergraduate students, Stephanie Olubara, created this with our input, and we ask that you use this and share it broadly. We think it's a great technique to incorporate. So I'm pleased to be joined by members of our SPH and campus staff and faculty. We have with us today Dr. David Petersen. He's a staff psychologist with the University Counseling Center. Dr. Petersen will be discussing emotional, psychological, and physical self-care strategies for managing stress during this highly stressful time. We also have with us today Dr. Mariana Falconier. She's the program director and associate professor for the Couple and Family Therapy Master's Program in the School of Public Health's Center for Healthy Families. She's also the founder and director of the Together program. Today, Dr. Falconier will talk about the impact of stress on our relationships, how to manage stress individually and together with others so that we can feel better and protect our relationships during stressful times. We also have with us Brielle Merchant, who is coordinator for the Happiness and Wellness Initiative in the Office of the Dean in the School of Public Health. And Brielle's work focuses on designing corporate wellness programs and content creation for brands. Today, she will focus on prioritizing self-care as imperative for everyone. Brielle's a certified health educator and yoga instructor. She will show us how to use the dimensions of wellness as a way to de-stress and create self-care routines. This will include specific tips and tools you can use right now to welcome more calmness and relaxation. We also have with us Brian Medina, program manager of the UMD BISS Incident Support Services with the UMD Office of Diversity and Inclusion. Brian will discuss current support spaces and how they have been for encouraging self-care, how they challenges for marginalized populations navigating the election results in multiple pandemics, how this adds enormous and complex stress on our mental health, and especially while in isolation from friends and family. He'll also mention how restorative practices intersect with this work, particularly as we acknowledge how identities and injustice shapes our response to stress. So thank you all for joining us today. We're going to start with a presentation by Dr. Petersen. And Caitlin, if you could please upload those slides. While you're doing that, I just referenced that we do have our happiness and wellness resources. I'll share the link with that at the end of this so that you have access to that. And if you would like to, you can sign up for the newsletter, a Happy and Well e-newsletter that we produce from the School of Public Health and that we partner with across campus with folks like the Counseling Center, Recwell, the Health Center, and the Office of Diversity and Inclusion. All right. So Dr. Petersen, thank you so much. I'm going to spotlight you, and if you could get us started.
Okay, so there we go. So thanks, Erin, for getting us started. I'm really happy to be here. What I'm going to talk today about are really self-care and coping strategies, as Erin said, during this time of multiple challenges. We'll go to the next slide. It really begins with awareness. And so what I want you to do during my time with you is to keep these two questions in mind. What are my reactions to stress, especially related to COVID-19, racial injustice, election uncertainty, certainly also working and studying online, just everything virtual. And also, what do I typically do to help myself feel better? And what can I add today to my wellness tools? And I say that assuming, and I think it's true that most of us do have our coping strategies that we really have to, during this really difficult time, be more intentional about using. Okay, next, please. So as you can see here, we may have symptoms of stress in a number of areas, the physical, emotional, behavioral, and cognitive areas. So as you look at these symptoms down the sort of middle column there, you may recognize some of your reactions. When we're stressed and worried and feeling anxious, the brain sends messages to your body, and it tells us to be ready to react. But that can be different for everyone. So you may recognize down that first column in white yourself in some of these areas. And to the right of that is what we're trying to avoid by not coping as well. So the final column on the right side indicates more long-term reactions to stress that you haven't recognized or done the best job in managing. Okay, next, please. So I'm going to go through in those areas that we saw where we see common symptoms, some helpful strategies. That's what this is about today, are wellness strategies, self-care strategies for dealing with the negative reactions to stress. Some you'll recognize, some may be new to you. So I want you to keep in mind, is there something here that I could take away that I'm not doing that fits for me, that might work? So we're often, I think on this list, aware, and we hear often that it's a good idea to take a break from our electronic devices that provide us 24/7 updates on what's going on, not always what's going on well in the world. It's very tempting to be constantly checking that, especially since we're in a totally online environment where it's so easy to keep checking. But that's a big one. If you can take breaks, so certainly before you go to bed at night, turn off your devices. But in terms of giving your brain a little rest from the things that are distressing, and spending more time connecting with other people, even if it is online. It's easy to sort of let that go and say, I'll just wait until we're in person again. But well, there's a lot of research that indicates that your mood can be really positively impacted through interactions with others, and certainly online interactions count. That last item there is important because when we're overwhelmed, it's easy to tend to focus on what we're not doing well or how bad we feel. And if you sit down and make a list of your strengths or your positive attributes, it reconnects you with those parts of yourself that will make you feel better and improve your mood. Next, please. Being organized can ground us and sort of help to distract us from the negative emotions that come with stress. Taking breaks are really important. And in your time management and your scheduling, we all hear this and we sometimes tell each other this, but it's okay to set limits. And I hear from a lot of students that working all day long or being present all day long and available online. Staff and faculty will say the same thing. I feel like I'm working harder and I never get away. So setting some boundaries and saying no is really important right now. Next, please. So in terms of emotional self-care, again, it's about connecting with people. The goal isn't to try to eliminate negative feelings. So you need to also recognize that it's okay to feel badly for a while. We don't, the more we try to like deny or eliminate the negative emotions, the more they're going to sort of build and crop up in ways that are counterproductive and unhealthy. So as you can see on this list, there's some suggestions for connecting with feelings through activities. Okay, next. Research also shows that activity, good nutrition, and adequate sleep, which is 7 to 8 hours of sleep consistently, if possible, all have a positive impact on mood. Those are sometimes harder to, or easier to talk about than to do, but it's definitely, these are definitely areas to strive for and that you can do that are readily available to work on. You want to also make sure that you're keeping in touch with your physicians or self or care providers so that that's not complicating coping during this difficult time. And as we learned and got a taste of it starting out with this workshop, deep breathing and progressive muscle relaxation are two go-to behaviors that will improve your overall well-being as well. Next, please. This goes without saying, but the temptation often is to self-medicate, even if we might not be thinking of it that way, but being aware of how you use alcohol and caffeine and other substances to cope, and finding other ways that are certainly more healthy that we've seen on the previous slides that would replace that. Massage can be super, super important for reducing stress, as well as just getting outside. And if you're like me, it's a day like this, I'm going to find some time to be outdoors, even if it's for 20 minutes, to kind of rejuvenate and restore my balance. Okay, next, please. There are other important areas that, you know, we all have sort of different relations in terms of our spiritual and religious beliefs. So make sure that you're tapping into that and doing what fits for you within your spirituality or religious beliefs to add to your coping toolbox. Okay, next, please. Boy, that goes fast. I'd like to go on to the next slide, please. And the next slide, please. So this is some really interesting news that if you read the Diamondback lately, you saw this. The Counseling Center administers the new student census to incoming students in the summer, early summer, about a number of things, but including well-being. And their questions were asked about how much the pandemic has negatively impacted them. The vast majority, I think 99%, that said that definitely the pandemic has had negative impact. And we saw that many of the reactions to that were less than healthy. Marginalized student groups overall, and that's including those from lower SES backgrounds, racial and ethnic minorities, and first-generation college students, reported experiencing the worst effects than their peers. So unfortunately, we learned that it's really impacting students. But the positive silver lining in this is that many of the students reported making some meaning out of this experience and growing as a result of it. And they reported some strategies that they're using, and they reflect a lot on what we teach in in therapy and in other realms. So these are the items, these are the most common coping strategies that Maryland students, new students this year have reported using. So it's something that we can all learn from. Using social support, you know, connecting with others, as I said earlier. Considering just what's in your control and what's not, that's active thinking and planning. Taking steps that you can reasonably use to affect your situation. Practicing acceptance, that is accepting that there are limitations to what we can do. Practicing self-care, which is what a lot of what this workshop is about. Positive thinking, considering whether there might be something positive that you can take away from the situation that we're in. Leaning on faith, again, something that I've already mentioned, and altruism. That is like volunteering, making donations, sewing masks for people, but kind of like getting a perspective on your situation relative to others. All of these were mentioned specifically by students from Maryland who came in this summer to the university. So something for all of us to benefit from. And that's it. I'll turn it over back to Erin.
Great, thank you so much. I just put a question or a prompt in the chat space to everybody to just take a moment to share one thing that was a takeaway from Dr. Petersen that you can incorporate into your life. We'd love to see this in the chat space as Caitlin moves the slides to our next speaker, Dr. Falconier. I know for me, the reminder to focus on a strength is really important. Okay. Caitlin, thank you for putting the slides in. As we look for those, I am going to spotlight Dr. Falconier so that she can begin speaking.
Okay. Well, thanks for inviting me today. And we can move to the next slide. So I prepared the presentation thinking mostly about couples, because that's what I do my research on and, you know, what I work most with. But really any of the things that I'm going to be talking about, you can definitely think about not just, you know, couple relationships, but also other kinds of relationships like friendships, so, you know, relationship with a family member. I think that you can easily see how some of the things I'm going to be talking about can be, you know, expanded to other relationships. So lots of things has changed with current times. We have definitely a lot of stressors that all of us are dealing with that were mentioned before, that it's not just COVID-19, it's the stress that comes from election times, you know, from, you know, the racist environments and, you know, tragedies that we've all witnessed. So there are stressors of all kinds. And these bring about other stressors, you know, economic, medical, etc. So these are stressful times for all of us. And one of the things that has happened when it comes to couples relationships or other relationships is that we found ourselves, many of us, spending way more time with, you know, our partners or our loved ones more than what we had before, or with a friend. And that creates also challenges in itself and other stressors. And it's a time of high uncertainty at all levels. And that's a huge source of stress. And what I'm going to be talking about is like how each of us handle that differently. And that has an impact on relationships as well. Next slide, please. So when it comes to couple relationships, I mean, and some of the things have been addressed by Dr. Petersen, you know, we may end up experiencing anxiety, depression, irritability, we may withdraw, we may be more impatient. I mean, the list can go on and on and on. But at the end of the day, in terms of relationships, what matters is like when we, you know, are experiencing any of these, you know, negative emotions or feelings, they're going to have an impact on our relationship, on how we perceive others, how we handle differences, how we go about conflict. And one of the things that, you know, this stressful environment and changing conditions have brought to all of us is that when we're in a relationship, we may have different needs and different standards about different areas. And so during these times, we sort of need to revisit and look again at whether what we had before is working or where we need to change it. And so we're experiencing, many of us, you know, challenges with our partners, for example. And again, it can be with friends if you're living with them, in terms of how you manage your time and space. You know, what worked before may not be working now. Now I spend a lot of time, for example, with my husband in my home, and definitely we had to renegotiate where each of us work. You know, how we deal with the kitchen, for example, whether it messes up all day long, it's messed up all day long, or we actually are going to preserve it during some times. Whether a lot of rules and understandings and agreements we had from before right now are not enough for our current reality. Our social life has changed. You know, we also have differences in, you know, risk taking. You know, whether one of us believes that we can go out and go to the grocery store by ourselves, or participate in a parade, or even the other day whether we would go to celebrate or not, you know, what was happening with elections, or we had to stay at home. So their difference is also about how to handle money. Is this a time for saving? Is it time for spending? You know, and it depends on what's happening, you know, what your resources. There are changes also in intimacy. You know, I mean, all these changes have affected, you know, desire, you know, our need for intimate connection, or our time, you know, our need for being a little bit more removed or distant. It all has also affected, you know, other areas of individual and relationship needs. What used to work before in terms of, you know, how much time we spend together or separately, now maybe may look different, you know, because we are all day long together, perhaps. And in some of your cases, if you have kids, it also has affected parenting with these circumstances, because you may experience that how you want to handle the kids during the pandemic may change a lot, you know, now when there are, you know, challenging circumstances, like, you know, how much time they need to spend on screen time when they're all day with, you know, connected through Zoom, or whether you need to take them outside more or not. I mean, again, I think that the take home message here is like what you had in place before with a friend, with a partner, or in terms of relationship with a family member, right now may have been disrupted completely. And it disrupts all aspects because it requires a lot of renegotiation, because the structure that our lives had before is not so much in place now. So next slide. So of course, how each relationship handles these challenges depends on a variety of factors. And this list is not going to be the full list of all the factors, but it makes a big difference where you were at the beginning of a relationship, where you have been together for a long time, where you're about to move in together or not. It also varies a lot depending on the quality of a relationship. You already had a relationship that, you know, in which, you know, there were heated arguments and it was difficult for you to de-escalate, or whether it was a very strong relationship with where you felt close to each other and connected. COVID-19 will not make things disappear, but definitely, actually, on the contrary, when there were issues before, probably this context of demands on the relationship and, you know, a lot of stresses is going to exacerbate what was there before. Whereas some couples that were doing very well before may experiencing some challenges, or actually feel that they actually got them closer together. It all depends also on the resources you have. You know, relationships are affected. I mean, if you don't have to be concerned about finances, if you don't have to be concerned about the space where you live, of course, you're going to face these challenges differently. And of course, individual issues. You know, some people have, you know, some particular mental health issues, or some particular, you know, needs that they need to deal with, that also affect how they handle the relationship during these times. I would keep, of course, it also pile up of stressors. If on top of everything we've been talking, you were dealing with, for example, the selling of a house, or preparing something important in your life, like, you know, a wedding that had to be canceled, you know, or if you're dealing with a chronic disease of a family member, I mean, these make things worse. And again, in the same way that we said, well, it depends on where you are in the relationship, definitely whether you were about or handling, a very critical life event also plays a role in the relationship. There's a lot of grieving that's happening in many couples about things they wanted to do that they had to be postponed. And as I said earlier, not knowing for how long you have to postpone them, also creates anxiety. And of course, how the couple does has to do with where they live, or in terms of the restrictions you have imposed from the governments in each county and state. Can we move on to the next slide? So what I'm going to do with the next two slides is first give you sort of overall ideas that we typically consider when we're looking at relationships, and then more specific recommendations. The very first thing is that we always say, to acknowledge, as Dr. Petersen said, to acknowledge that things have changed, that we're feeling differently, that we're experiencing things differently, and to remain flexible and creative. But in terms of relationships, really to make the space for talking and try to be a good listener. When you're making the space for talking, what you want to do in that talk is of course, acknowledge that things have changed and identify and recognize what are the strengths and challenges that your relationship had, and try to see what you guys are doing now that can actually, deal with those challenges and also capitalize on those strengths you had. Like, for example, if you're in a relationship where one of the strengths is that the time you spend together doing things together, you need to try to preserve that somehow in the new reality. If one of your challenges was, the escalation of arguments, you really need to understand that this is a context where it's more likely for that to happen, and how you really need more than ever to work on, your de-escalation strategies to avoid, a very heated conflict. The other thing is that to see what sort of challenges and strengths have been added in the current context, and to negotiate, like when we were talking earlier about, okay, now a space in the home or space where we're living is an issue, or like how many times if we're not living together, separately, and if it's a relationship, long distance, or it's, we're not actually sharing a space, how much time we spend, talking to each other during the day, how often we connect, etc. So things have changed. So the important thing is to be able to sit down, talk about this, and negotiate, temporary arrangements. And I sort of highlighted temporary because one of the challenges for couples when they sit to talk about these differences, this fear is like, well, I'm changing this as it's going to be this way forever. No, some of the things you come up with right now doesn't mean that they're going to stay forever. This is just how you're coping with reality now, and the reality is going to change eventually. Some of these things will stay, some of these agreements, and some will not. And then the other thing that I strongly encourage everyone to talk about, this is my area of research, is actually the individual and coping mechanisms you have individually and as a couple. It's important that you actually can talk about what works for you individually, what you have used from the list that Dr. Petersen said, and what is the impact of that on your partner. The example I would give of that, and I know I'm on time, so I'll finish with this. The example of this is typically when you are doing something that perhaps is of benefit for you and helps you deal with your own stress, but not maybe beneficial for your partner and for the relationship, avoiding talking about what's going on, or trying to spend too much time, doing an activity that leaves your partner out for longer hours. So you really need to keep an eye on that. And of course, remain connected and compassionate. So my next slide, Erin, that I'm not going to talk about, but I hope you can share with listeners, is like, there's a list of specific suggestions about, keeping routine, exercising, keeping an eye on screen time, using good communication skills, etc. But I would focus a lot as take home on making space for yourself, and within the context of a relationship, not getting lost in all this time in the relationship, but really make sure that you have time for yourself, and that you remember that what can work in other relationships may not work in yours, and that you get help if you need, through couples therapy, or joining a psychoeducational program for couples, etc. So sorry that I went over time.
That's okay. Great. Thank you so much. We're continuing to get so many great tools and resources from y'all. So thank you so much. As we move to our next speaker, Brielle Merchant, I want to put a prompt again into the chat space. You can share something that you took away from Dr. Falconier's talk on prioritizing yourself in a relationship, and something that you may have learned that you need, something that you need to express that would support a healthy relationship. So if you'd like to share anything about that in the chat space, and we're talking about relationships broadly, it may be a partnered relationship, it may be another familial relationship, a very close friendship, anything like that, please feel free to share in the chat space. Okay, Brielle, thank you so much. I'm going to go ahead and spotlight you, and you can start.
Good morning, everyone. I'm a merchant. My pronouns are she, her, and hers. I'm a University of Maryland School of Public Health alum. So my Bachelor's of Science is from this School of Public Health. I also have a Master's in Health Administration. I'm certified to create and provide health education resources. And as of May of this year, I did become a registered yoga teacher. So wellness is my education, work, and lifestyle. And I'm super excited to join the panel today and share some tips with you all. So thank you so much for having me. Next slide, please. So today I will be discussing how to prioritize wellness and self-care while you work. I'll share actionable tips to help you create self-care routines. This is going to be perfect for anyone that is a student, an employee, or the person that wants to be successful in the work that they do every day. We know that total well-being and regular self-care support our work and our life goals. We thrive and do best when our health and well-being thrive as well. Next slide, please. So using today's tools, you'll be able to relax and unplug when needed. You'll be able to feel good and also optimize productivity in both work and life. Next slide, please. Here are the different dimensions of wellness. Total well-being means that we have what we need from each of these different dimensions. So as individuals of our own identity, everyone flows and operates differently, which is why I firmly believe that self-care must begin with self-awareness. You have to be able to check in with yourself and understand what you need. Next slide, please. So checking in with yourself regularly is a really good way to assess your current needs and desires. To really try and help with this process, I've created a few quick journal prompts that you can use to check in with yourself regularly. So feel free to write these down as we go along, or to even just take a quick screenshot. Next slide, please. So the first question, and this is one of my favorite, is how do I feel? For me personally, I love to wake up in the morning without any technology, without scrolling on social media or checking my email, and just simply ask myself, how am I feeling? From there, I then like to ask myself, how do I want to feel? And this can be for the day, it can be for the moment, but really just checking in with yourself to ask this question. Next slide, please. The other question that you can ask yourself is, what do I enjoy? Next slide, please. And then the third question that you can ask yourself in order to check in is, what do I need, or what am I curious about? So these are questions you can ask yourself in the moment, or you can use these as journal prompts to journal throughout the day. Next slide, please. After you've checked in with yourself to see what you need, you want to go ahead and pinpoint specific wellness activities that you will decide to engage in regularly for self-care. Next slide, please. So now in these last few minutes, I want to go ahead and talk about some specific wellness tips and activities that you all can use right away. Next slide. So let's discuss ways to enhance your environmental wellness. I have listed here 3 of my favorite ways to do this. That being aromatherapy, which is the use of essential oils, crystals, which I actually have a few with me right now, and then plants. So with the essential oils, they're natural, and you can choose different essential oils based on scents that you enjoy, or you can even choose specific essential oils to support your health and wellness goals. So for instance, maybe oils that help you relax, oils that relieve migraines, or maybe even help you get a good night's sleep. Similar to oils, you can also choose different crystals. So you'll see that they all look kind of different. You can choose crystals to match your intention. So for instance, maybe pyrite here for abundance, or clear quartz for clarity. And you can even use these crystals to decorate your space or wear them. And then lastly, plants are a great way to infuse a bit of nature into your built-in environment. Some plants are even natural air purifiers, which is an extra bonus. Next slide, please. Let's briefly talk about physical wellness. I do believe this is the dimension of wellness that we usually keep at the forefront of our minds more than the others. I would say it's very important with all the dimensions to recognize your identity and honor what you need. So this can just look different from person to person. For me, when I was an undergraduate at the University of Maryland years ago, I really loved going to Epley and getting on the ellipticals, going to the Zumba classes. A few years later, when I attended grad school in Arkansas, I found that I enjoyed powerlifting. Now, years later, I'm very much into meditation and yoga, which are two activities that I've always known the benefits of, but never thought that I would enjoy. So it's important to always explore, keep an open mind, and also just honor who you are. Next slide, please. So let's talk about some specific activities you can use right now. This first one is legs up the wall. So I really love this restorative yoga pose because you can pretty much do it anywhere. You just need a wall. As you can see in this photo, my legs are propped up against the wall and my arms are laid out relaxing. I have put on here that you should hold this pose for about 5 to 10 minutes, but even if you can do it for a minute or two, it's very effective in providing relaxation and a sense of calm. Next slide, please. You also can take mindful pauses throughout the day. So maybe doing a 4-7-8 breathing technique like we did in the beginning of this, or even just connecting with your breath by seeing, how the rate in which you're breathing. So not slowing it down or speeding it up, but just simply connecting and being present. Next slide, please. So here are a few ways to create some healthy work habits, and there are many ways to do this, but two of my favorite are walking meetings and the 20-20 rule. So with walking meetings, you can add movement to your day, and also it really helps your brain get into a creative mode of thinking. For the 20-20 rule, you really want to, every 20 minutes, look away for at least 20 seconds at something 20 feet away to prevent eye strain or even any neck pain that you may be feeling from being in the same position for a prolonged period of time. Next slide, please. So I do encourage everyone to get out and get fresh air. Just simply going out, looking around, breathing in the air, maybe even taking a walk. And if you find that you aren't able to get out and go for a walk or go outside, try opening the blinds and the windows so that you can breathe in the fresh air and even hear the sounds of nature. Next slide, please. Lastly, make it always a priority to unplug at the end of each day. So putting your devices on do not disturb, logging out of applications, turning them off. Also limiting your email checking. So maybe checking 3 times or 2 times a day. And what really works well for me is to block off time for specific projects and even block off time for self-care. The other thing that I would share with you is that I worked from home for 3 years, even prior to COVID, and we never once used video. It's a wonderful tool for connecting, but maybe consider adding balance by deciding when to turn it off and when to turn it on. So perhaps turning it on in the beginning of a meeting to introduce yourself, and then later turning it off is a good way to just add balance. Next slide, please. So these are just a few ways that you can prioritize wellness and self-care while you work. Next slide, please. I really encourage you to remember to embrace your own identity and desires by checking in with yourself regularly. If you did enjoy this and you're interested in more ways to prioritize wellness or self-care, I do have a wellness for self-care and productivity list that will be available for free download. It includes some of the activities and tips that we were talked about today, as well as 30 others that will help you prioritize wellness and self-care while you work. Thank you.
Thank you all so much. All right, as we're moving to our next speaker, Brian Medina, I want to put a prompt again in the chat space. If you can share an actionable tip you identified through Brielle's presentation that you'd like to incorporate now into your self-care routine. So Brian, thank you so much for joining us. I think you are going to bring great perspective, prioritizing identity and culture and restorative practices into our well-being. I'm going to go ahead and highlight you here, Brian, and thanks for kind of bringing us home today in this conversation.
Thank you, Erin, and thank you one and all. I know that we're limited on the white construct of time, but I'll certainly keep my remarks brief as we ask questions and engage each other. The first real point is to talk about power and privilege, the systems of oppression that really get us to why we are even having this conversation. So the idea that COVID-19 has had disproportionate impact on Brown and Indigenous communities, Black communities, is obviously then impacting how we respond. And so we talk about mental health, we talk about stress, understand the cumulative effect over decades, over centuries of our varied communities, of LGBT folks who have been discriminated against by our mental health agencies and told that we are not, that we are actually an illness rather than an actual accepted group. For folks that are not able-bodied, they may not be able to go for a walk. And so I appreciate Brielle's commentary about at least opening a window perhaps. That a lot of the tips we share are very steeped in the very oppressions that we're actually trying to fight against. And so understanding that as we are engaging our communities, that to each their own. So when self-care, maybe it's meditation for folks, maybe for some other folks it is prayer, but also many others in various religious communities, prayer is a communal exercise. And during COVID, that can be very challenging. So acknowledging that our own power and privilege, our own participation in white supremacy, our own participation in all the various isms is impacting every element of this work. And so ultimately, when we're trying to then engage with one another, restorative practices is where we go. Restorative practices, broadly speaking, and it is an Indigenous practice, so I want to name that as well. It is really a method for us to say we are no longer just about individuals. Even though in our society, the United States context, we often think ourselves as our own selves, they were also thinking that we need to be right with one another. And so it's repairing the harm, one to an individual to another, but also communities one to another. And so some of that could be done through the means of connectedness around, particularly around the election. A lot of folks, there are high tensions right now, folks that won the election versus those who were lost. Then what is that relationship one to another to say we need to bridge that divide, but at the same time, acknowledging that the most marginalized communities are the ones not having to do all of this work for themselves, because ultimately that has been what our 400 years of oppression in history has done. For us, it's really important to then acknowledge where we can then, as individuals, as communities, lend a hand. So some of that is about supporting better funding and support for mental health agencies toward communities of color, toward LGBT communities, toward those with varying abilities, acknowledging that there's still a stigma attached to that. And so some of that is going to take time for us to negotiate some of that trauma and appreciate that we have to learn as our various institutions how to really make sure that we're centering folks appropriately. Again, going back to restorative dialogue, I really appreciate Mariana's sharing of just holding space for one another. Throughout last week and this week, I've held post-election and pre-election spaces for folks just to be, not to talk about politics necessarily, but more to say, how are our relationships impacted by this division? How are folks being able to be with themselves, not knowing the results and the uncertainty around COVID and the vaccines to come, but also the disproportionate impact that medical health industries has had on folks of color. There's a distrust there, understandably so. For me, it always goes back to how do we then reconcile and restore that relationship with one another? And so doing that, again, building trust, holding space, listening provocatively, when folks are sharing their story and their trauma, to be as centering on them as well, and not just be immediate to say, my resolution is X. Most of this is not about resolution in the moment. It's about being and supporting others being. When we get to that next step of being able to say, we provide care for one another, It's again, going back to not reinforcing those same ableism, sexism, homophobia, isms that we're addressing. So some of this is about doing the work for ourselves. We often will go and say, well, let's do a reading circle. That can be helpful. But what about that book is also centering whiteness, white fragility? Let's say we're also trying to afford folks the opportunity for yoga, which is a fantastic experience. How are we then navigating that for folks of varying abilities when we encourage that opportunity? Maybe it's more so about the breathing techniques and what are the common threads that folks may be able to need. We're addressing some of these larger societal issues. Know that it takes time, but that each and every one of us has an opportunity to address that on our own. So again, I'm going to share in the chat just where my office, the work that I do, our forms, the dashboard, things that are just kind of more relevant to the work if somebody were to have a bias incident. But acknowledge that some of the work that we are also doing is around programmatically how to support students, faculty, and staff to be their best selves in the midst of a community and not just as individuals for themselves.
Thank you so much, Brian. I really appreciate too that you mentioned land, and I want to just say also for our land acknowledgement, we have started incorporating a land acknowledgement into our events and other areas in our school public health. And so I just want to say that we honor the Piscataway people and their ancestors. It's upon their land that we reside and we study, we gather, we work, and we live. And I'm going to also share a link in here to the full land agreement statement, and also just say thank you to both Micah on campus who developed this land acknowledgement in ensuring that folks across campus incorporate this in their events and other planning. I think one way that we're talking about doing that is also through like perhaps course syllabi or in conversation in courses. So I want to bring folks back together. We have a few more minutes, and I will share a couple of resources in the chat space with everyone. And Brian, let me take you off. Okay, spotlight video is off. So we have everybody just joining together as panelists. I want to bring one question from Brian first, and then we'll move to everyone. Let's see here. Okay, so how do panelists center marginalized populations and provide maximum care and resources to those who need them the most?
So I started down that path, but I think another area that I hadn't touched upon, I know was previously discussed, was about having the means. You know, when we talk about wealth, we often are not understanding the accumulative impact of that for folks over generations. And so for folks who have wealth now, can then share some of that. So in terms of centering marginalized populations, we often then don't talk about how mental health agencies, maybe there's a sliding scale for folks as they're entering into therapy, or maybe with medical health, we charge folks with wealth more. So in terms of really kind of navigating that in terms of funding and resources, I also think on more of an individual basis, because of course that's more systemic, that how we do this is connecting individuals to care by then ensuring that our relationships with one another, that how often are you extending yourself into communities where you disagree with folks, or where you may not have similar identities, where you may not have similar backgrounds and experiences. And some of that is around being vulnerable. You know, I often share about being a survivor, being Latinx, but white passing, you know, being somebody who's genderqueer. Some of that can be a bridge, but also understanding that not everybody is going to embrace that. So how that vulnerability in positions of privilege can then help to kind of allow folks into spaces being their authentic selves while acknowledging that there's still work to be done between us.
Thank you. Would anybody else from the panelists like to comment on that at all, or should I move to a next question? You covered it really well, Brian. So thank you. All right. Next question. How might you distinguish self-care from self-help for those that are in our audience or participating today? I don't know, Brielle or Dr. Petersen or Dr. Falconier, do you all have any comments on that?
Sure, I'll go ahead. I would say that there can definitely be an intersection between self-help and self-care. I think of self-help as maybe the resources that I seek to help with a particular situation or challenge, or I don't even like to say challenge, but maybe area of opportunity in my life, where self-care may be those tools that I use on an everyday basis, but I would definitely say there's intersection between the two.
Thank you so
Yeah,
much.
yeah, honestly, not sure until today. I thought a lot about this difference, but we use self-care a lot with each other and with clients in therapy, and think it's really a more of a kind of like a internal, if not, or personal, or very sort of self-focused. It's like, it's okay to be good to yourself. And I think of self-care as then the behaviors that we may engage in, similar to what Brielle said, that would get us there. But self-care is a reminder of a need. Just that term is a reminder of that importance that we place on that when we're in distress. So, and self-help being something that you sort of enact to get there.
Great, thank you. What can you all share, especially for our clinicians, about navigating barriers to mental health care so that folks can focus on moving forward, a strengths-based perspective, and getting support?
I think the first thing is acknowledgement around those barriers in itself. Oftentimes we don't talk about how racism and sexism and homophobia is existent within mental health care. And so acknowledging that first and foremost, demonstrating here maybe support groups or maybe staffing, if there's a possibility of hiring more staffing to align themselves to assist certain populations. I think those they're not automatically going to turn out folks to immediately trust, but at least representation is going to matter. The second step, I think, is showing that it's a sustained effort rather than a simple response to an issue. So I think the proactive care, we often, again, when it comes to medical health too, we say, well, we're sick, and so we go to the doctor, or we need to see the hospital, and so it's a reactive response. But the preventative care, the same when it comes to preventative maintenance for our own mental health and well-being. It's the routine, it's the connecting with therapy, even when there isn't a major issue. I appreciate, again, Mariana talking about couples and conversation. A lot of this is responsive because COVID has put us in this position of having to navigate how we're going to share space with one another in a very tight environment. Some of this can be then maybe more proactive in the future to say, with anybody we might be living with or connecting with, how can we make sure that we're checking in? So at the beginning of conversation does not mean we're getting right into business and here's the time and order we're doing things. Truly that it's about centering each other's humanity first and foremost, and that is preventative care.
Thank you.
I have a lot to share about this because I teach the gender and ethnicity class in the couple therapy program. So there are so many things to say, but what I would say is that definitely providing cultural sensitive competent services is a key factor. And in doing that, it's like even how we speak about mental health, and it's, a key aspect. Obviously, removing barriers has to do with goes from childcare, transportation, knowing the language, knowing the culture, going where people are, facilitating access to services. And of course, one of the ways is like by reducing and making affordable fees, no doubt about that. I have to say, we have a program for couples to give them financial and relationship education. And we're just targeting especially the Black community and Latinx community, because those are the ones most affected right now by COVID-19 and the one having fewer access to resources. So we're trying to make that affordable, not affordable, this is a free service, but we're going where they are. We're specifically going to the cities and agencies where, you know, these populations will tend to go. And I think that that's a way of reducing health disparities. We're going where people are and becoming part of the community and working with a network of, you know, agencies and community resources to make, you know, things available to the community that many times are not, you know, aware where they are. And it's not their fault, it's ours, because we're not actually spreading the word in the right place. I don't know.
Erin, if it's okay, I'd like to just take 30 seconds or less to answer this. These are all really great strategies, especially as a healthcare provider. But I want to also maybe provide strategies for an individual. So going back to what Brian said, I think the first thing is to definitely acknowledge what you need. And then I would say from there, perhaps even voicing that and sharing that when you are seeking resources. I think the beautiful thing is that, you know, in 2020, we have so many options. We're aware of so many different identities. And so a lot of the mental health resources out there can actually be tailored to what you need. You can see a therapist that has the same background as you in many ways. So I just wanted to point that out for individuals.
Thank you so much. I think too that segues a little bit into this final question that one of our audience members wanted to ask. I'm putting in the space, and maybe Dr. Petersen, you can comment to this, but you know, folks are concerned about the appearance of and not wanting to let anyone down. How do they ask for help without giving an appearance that you're letting someone down in your team, but you're still taking care of yourself?
Well, I'd like to think that team members and people around us would agree that asking for help is a sign of strength, that asking for help is a positive gesture, not something that should be, you know, frowned on or considered. I know that doesn't make it comfortable for the person asking for help, but it's a start, is to model that and to see that, you know, in my work, I worry about the folks on campus who don't ask for help. And when they come in, by asking, they're telling me that they believe things can be different and that change is possible.
Thank you so much. This is just so many great resources here today and expertise that you all have shared. I really appreciate you all joining us today. Anything else that anybody wants to share as an audience member in the chat space? I'm seeing comments and some individual and as a group saying that this has been very helpful. We definitely want to share out this resource. And I'm going to put a few other things in the chat space so that you have access to the counseling services, to the Center for Healthy Family Services, the Happy and Well e-newsletter, and our Happiness and Wellness Initiative. So I'm putting these things in there now. And then reminder too, as we mentioned, and we started out the program of the 4-7-8 breathing technique, that if you all incorporate that, we really do find that very useful in moments throughout the day. And then just mentioning, as you all shared, that this check-in is really important. And one thing that I have found through the course of these adjusted times of working virtually and meeting virtually, that the check-ins have been really valuable with team members. And as you shared, Dr. Petersen, around, you know, we would hope that our team members are caring about what's going on with us. Just little prompts, little quick questions, even if you're joining a few minutes before a meeting starts, or taking time at the very end of a meeting to connect with one another and see how they're doing in their lives, or, you know, what they're doing that day to prioritize their self-care. Even if it's taking a moment to go outside, as Brielle said, and breathe, or taking a moment of nature and center ourselves. These are all just really critical strategies, for self-care. So thanks for bringing all of this up. Thanks for coming with us today. We created this session as a response, or as a proactive nature, but also response to folks sharing, oh my goodness, there are a lot of things going on right now for us, and we'd really love to have support mechanisms to connect with and move us forward as we're going into another state of uncertainty around what COVID-19 is going to bring us, and also transitions in power with the election, and then seasonal changes. So please do access this resource, access the video recording. We will share the slides within it, and so that you can incorporate them into your everyday life. Thanks, everyone.